very much, Graham. I'm John Montgomery. I've been a GP in Govan for over 30 years, and I'm the lead clinician for the Govan SHIP project, which is a Scottish Government-funded project started in 2015, based in 4 deep end practices in Govan. It's got 2 principal components. One is the employment of young GP locums into the 4 practices who provide backfill to the experienced GPs, giving them approximately 1 session per week to focus on those patients of greatest need. Second component was the development of structured multidisciplinary team meetings. These are held on a monthly basis in each of the 4 practices. They last for approximately 2 hours, and you can see the great array of different colleagues who are present in attendance at these meetings. The patients are identified in advance of the meeting. Everyone arrives in the meeting with their IT systems open and available. So you have the GP EMIS system, our health visiting colleagues with their system opened equally with our mental health colleagues, and probably most crucially of all, our social work colleagues who arrive with ready access to the social work IT system. That allows for shared management to take place very quickly, with everyone to quickly agree on what the patient's needs are, a shared management plan being arrived at very quickly and shared between all the disciplines. We developed a referral form which was used by any of the disciplines inputting into the MDT to identify the patients that they felt were at greatest need heading into a crisis, with a quick summary of what the issues were. This allowed our admin staff to create a register in advance of the meeting, with that register being circulated to all the participants. And at the end of the meeting, again, equally, this shared management plan being arrived at and be annotated, and again, a register of the summary of those meetings being distributed to all the colleagues. This is probably quite an interesting graph. So you can see the kind of cumulative number of SHIP patients that we've dealt with over the 3 years, and the shaded area in blue indicates the number of patients who required social work involvement, and it equates to roughly about 30% of those patients that were brought to MDT discussion. Now, in terms of identifying the patients of greatest need, obviously if you've been working in the area for decades, then you're well versed to the population that you've served. And obviously we've been hearing a lot about Julian Tudor-Harton, who would know each and every one of his patients and all the details off by heart. And that local knowledge can't be underestimated when it comes to identifying those patients of greatest need. But Dr. Brian Milmore, one of the other GPs, and Vince McGarry, our project manager, also developed a multi-morbidity tool, building in the work of Stuart Mercer that we heard about yesterday. And again, it's just a way of formulating and identifying those patients of greatest need and looking at the number of chronic disease conditions that they suffer from. Does it make a difference? Well, the baseline, the black dotted line, indicates the kind of average GP demand for the average patients in the practices that we serve. The green line indicates the SHIP patients. You can see that already that they're of greatest GP demand. You can see that demand starting to rise, and then in the rectangle, you can see that there's a SHIP intervention, whether that's an extended consultation either in the surgery or in the patient's home, whether that's an MDT discussion, the creation of a shared management plan. But following that SHIP intervention, you can see that demand starts to fall. It suggests anyway that we're identifying patients who are heading towards crisis, and if not preventing the crisis, at least doing something to delay it. Here's some other hard figures. The green line is comparator practice, looking at home visit rates. And you can see in our comparative practice, home visiting rates was reducing. But if you look at the SHIP practices, the rate of reduction is almost double. And during the time of the project, we've managed to reduce home visiting by something like 60% in the participating practices. Again, implying that we're being proactive in heading off crises. This is another hard figure looking at GP demand. The blue figure is the SHIP practices, and over the 3 years of the project, we've reduced GP demand by approximately 12%, whereas in the orange line, which is our comparative practice, demand's been steadily increasing, and that's probably something that many practices in the UK can probably identify with. I mentioned that the GPs had this one session per week of protected time, which was used for focusing on those patients in greatest clinical need. But it's also allowed us to take part in leadership roles. And these are just some of the work streams that we've developed as part of SHIP, and the number of GPs within the Govan practices who have identified and taken part in developing these work streams because they've had the time and, probably more importantly, the enthusiasm to take this on. One of the other aspects of SHIP towards the end was we had a pharmacist attached to the project. He attended the NDTs in each of the 4 participating practices, and he focused his efforts on those patients with pharmacy issues that we were bringing to the MDT. You can see that these patients required just under 3 interventions over a wide range of different interventions, and although it wasn't the point of the project, it also proved to be cost-effective as well. Equally, we've had an MSK Advanced Physio attached to the practice over the past 1 year. He's provided 3 sessions per week for 3 of the participating practices, again embedded within the practice. From the patient's point of view, they're now getting to see a physio within a matter of days as opposed to a matter of months for the generic service. Most of the patients will only require a single intervention from the physio, and he's got referral and imaging rights. The patient satisfaction rates from the point of view of their appreciation of our physio are extremely high, certainly a lot higher than mine's, which is slightly worrying. From the GP's point of view, having ready access to someone who is on site and being able to discuss complex patients with them has proved to be a major advantage. A caveat, however, in terms of impact of MSK physio on GP demand, as we've demonstrated before, deep end patients do not come with a single item. The multi-agenda consultation is the norm in the deep end. So I think we have to say that the jury is still out on whether MSK physio is going to significantly impact on GP demand. But as I say, unquestionably, he's been an asset to the project. I mentioned that the young GPs were taken on as locums to free up time for the experienced principals to take part in the project. It's interesting that 4 of these young GP locums are now partners within the health centre. These young GPs who are now partners have replaced retiring partners who continue to work well into their 60s because they found this new way of working extremely satisfying. The morale in the health centre has gone up. We've been accused on more than one occasion of laughing too loudly at the Govan coffee morning. And I'm pleased to report that there are no GP vacancies in Govan Health Centre. The collegiate approach, how did SHIP come about? Basically, this came about because frontline clinicians wanted to see if there was something that we could do. Could we change the way that we were working and attempt to, in a practical way, attempt to address the inverse care law? We had support from academia. Graham Watt, University of Glasgow, provided the academic rigour. We had support from David Walker, our HSCP manager, who was enthusiastic and in fact suggested that we expand the original remit of the project from just working with social work to become a genuine deep-end project. There are good health service managers out there. We had support from our lead social worker, Sheena Morrison. RCG support has been absolutely crucial. And I think this collective bunch going to Scottish Government impressed them that this was a project that was worth funding and backing. And underpinning it all was our project manager, Vince McGarry, Vince, for most people in this audience, will know that when it comes to getting GPs together to come to get them to agree on anything, it's not easy. And Vince's job, or as he describes himself as herding cats, has been absolutely key to keeping the project going. We have to, of course, plug Graham's book. I'm reliably informed that he will still give you a copy of his book for £20, but as an additional incentive, he will let you take a selfie as well. We always like to finish with a montage of a kind of small demonstration of how the project has evolved over the years, whilst at the same time paying some tribute to Govan's rich shipbuilding heritage. May the deep end live long and prosper. Thank you very much.